This is an AQA Psychology GCSE revision video for the Paper 2 topic of psychological problems with a specific focus on aversion therapy, treatment for addictions. So before we get into what aversion therapy is and how it works to treat addiction, you have to have a general understanding of the concept of classical conditioning. So classical conditioning is going to be a key term when discussing aversion therapy. It is when individuals learn through the association of two things. So as humans, we learn to associate one thing with another. Now, classical conditioning was first discovered by Pavlov, who was looking at salivation in dogs. What he discovered is that actually dogs learn through classical conditioning. Dogs learn through association. And so what he found was that when presented with food, which is called an unconditioned stimulus, the dogs would automatically salivate. So they would automatically produce saliva. So Pavlov had the idea to introduce a neutral stimulus, something that does not cause a dog to respond in any particular way. So a bell, or in this image, a whistle, but it is a bell that Pavlov used. When he rang the bell, he noticed the dogs did not respond. So what Pavlov did through multiple pairings was paired the noise of the bell with the food, and presented the dogs with the food at the same time as the bell, so the dogs would salivate. Now, by doing this numerous times, what Pavlov managed to do was classically condition the dogs to associate the noise of the bell with food. So now those dogs, when they heard the bell, they automatically salivated without even thinking about it. That was their conditioned response. So you can have a look at the image to help you understand that, along with the key terms on the right hand side of the screen. Now, if you are aiming for a level 7 or above, it's highly recommended you attempt to use these key terms in your description of aversion therapy. However, if you are just aiming for a grade 4 to 6, then it's important for you to understand that classical conditioning is learning through association, and then this next part here that we're now going to translate into aversion therapy and how it works for people with addictions. So aversion therapy is the name of the treatment that you have to know, and it's based on the principles of classical conditioning, often used with alcoholics, but can also be used for other addictions such as gambling and smoking, and also really quite controversial and extreme behaviours. In the past, it's been used to treat homosexuality and paedophilia through the use of electric shocks. So the way it works with alcohol is that it is paired with what's called an emetic. So that is a drug which causes people to be sick. It causes unpleasant feelings of nausea. So feeling sick, that sort of, maybe you get it just before you go on a roller coaster, that sort of feeling of nausea, or when you're really nervous, that sickness in your stomach. So it's paired with alcohol. So they take the drug and then they consume alcohol. So that over time, the alcoholic will associate the alcohol with being sick and doesn't want that unpleasant experience again. So the moment that alcohol touches the lips, or maybe even just the scent of alcohol, they then associate it with being sick, with vomiting, with feeling sick. Through the process of the therapy, soft drinks and other drinks are given so that the person does not associate feeling sick to all drinks, and they're not conditioned for all drinks, but just for alcohol. So that's the premise of how aversion therapy works on alcoholics. But also, so we've got a recap here. It can also be used for smoking and gambling. So if we have a look with gambling, often they're given statements to read out loud, some related to gambling and some aren't. So when they read the statements that are related to gambling, they will receive a mild electric shock as part of the therapy. And of course, that's quite painful, quite irritating, quite frustrating. And so over time, the patient then learns or becomes classically conditioned to associate gambling with pain. And again, with smoking, patients addicted to smoking often are, as part of the therapy, asked to smoke repeatedly and intensely in a room, so in an enclosed space, and this then makes them feel nauseous and disgusted. It can give them very unpleasant feelings, which again causes then association, that classical conditioning between nausea and smoking. So through the smell, or even just through going near a cigarette, they get that association of it being an unpleasant experience and how sick it made them feel during the therapy, which should then deter them from consuming that substance again. So thinking about how we can evaluate aversion therapy, there are some questions or statements on the screen. I'd like you to pause the video, have a think, are they strengths or weaknesses, and how could you elaborate on them? So in 5 seconds, we'll go through the answers. So of course, in terms of whether aversion therapy actually works and evaluation, it has high dropout rates because of that unpleasant side effect or just the unpleasant nature of the therapy. So it might actually be too unpleasant, people give up, and therefore it's not effective. So it doesn't actually treat the addiction. It's also been a short-term fix compared to longer-term solutions. So aversion therapy, again, in the short term, they might be put off alcohol and the smell of alcohol for a while, but then that effect could eventually wear off, where what we call the classical conditioning becomes extinguished. So it becomes removed. The association's no longer there. They don't find alcohol unpleasant anymore. So extinguished is a really good key term. Again, if you're aiming for a grade 7 or above, you want to be able to use that term extinguished to explain how aversion therapy is actually a short-term solution. It's also a very reductionist treatment because it oversimplifies addiction to something as simple as a stimulus response, like Pavlov's dogs with the bell and the salivation. Actually, behaviours not always learnt. Behaviours like addiction, like the cage study shows, it could actually be due to a genetic vulnerability. And so by treating that one aspect of addiction does not treat all other aspects, such as the person's group of friends, if they associate themselves and hang around with people that are also addicted, that feeling of sickness that they might have got from the therapy is sort of going to be rationalised by their friends. They might be convinced to keep drinking, etc. However, aversion therapy can be combined with cognitive behavioural therapy, which is the treatment we looked at for depression, and therefore combining those therapies is a lot more holistic, because aversion therapy can tackle the behaviour of the drinking or the smoking, and the cognitive behavioural therapy can be used for the teaching the coping strategies in the situation like I just described, where they might be with a group of friends and they might be close to relapse into going back to that substance, but actually using those techniques they learn in CBT could be a really effective and more holistic, beneficial treatment for them. That concludes the end of this video. Thank you for watching. I hope you found it useful.